Now till now I told you about the three layers, that is skin, connective tissue and the aponeurosis, and these three layers basically work in a single unit and they move the scalp in a forward and backward directions. So movement of the scalp or the proper scalp is only having three layers, that is skin, connective tissue and aponeurosis. Beneath the aponeurosis there is a space that is subaponeurotic, as it is beneath the aponeurosis, and this is basically the layer of loose areolar tissue. You can see the loose areolar tissue is attached till superior temporal line. It will not extend in the temple region, as the epicranial aponeurosis is attached to the superior temporal line. In the front it will extend till eyebrows. As you all know, the frontal belly is not having any bony attachment. On the posterior aspect it is limited by the superior temporal line, the superior knuckle line. As you know, the occipital bellies are attached to the superior temporal line. So here it is showing the extent of subaponeurotic space, that is the layer of loose areolar tissue. So here you can see the emissary vein. Emissary veins, they are the valvulus vein which are connecting the veins of veins of scalp with the cranial venous sinuses or dural venous sinuses. There are two emissary veins, parietal emissary vein and mastoid emissary vein. The parietal emissary vein will pass through the parietal foramen and connect with the superior sagittal sinus, while the mastoid emissary vein will pass through the mastoid foramen and it is connected with the sigmoid sinus. Now if there is any injury in the layer of loose areolar tissue, what will happen? If there is any injury in the skull bones, or the blood can come in this layer of subaponeurotic space, that is the layer of loose areolar tissue. As the frontal belly is not having any bony attachment, so it will come and settle down in the eyelid. Basically, normally the back eye is due to the local violence by making a fist, but this is another reason. By head injury, 2 to 3 hours later you can see the black eye because of collection of the blood in the layer of loose areolar tissue. The layer of loose areolar tissue is even known as the dangerous layer of scalp. Why it is known as dangerous layer? As you can see, it is having very extensive reason. So if there is any infection or pus, it can be settled down over in this layer, and these emissary veins, as they are traversing this layer, so they can pass that infection to the dural venous sinuses. Beside this layer is dangerous layer. It is also known as safety valve hematoma. Why it is known as safety valve hematoma? Because if there is any fracture in the skull bones, then the blood will be whole collect in the loose areolar tissue layer. Till that time, the compression of cerebrum will not take place. So that is why it is working as safety valve hematoma, besides being the dangerous layer of the scalp. Now the last layer, that is pericranium. Pericranium, basically the periosteum of the skull bones. It is loose all over the bone except at the sutures. It is firmly attached to the sutures. Cephal hematoma. If there is any subperiosteal blood collection, then in that case the blood collection will take the shape of the bone, as the pericranium is loosely attached over the skull bone except in the region of sutures. It is most commonly seen in the parietal region, as you can see in this newborn baby too. Now the nerves which are supplying to the scalp, I told you already there are basically 10 nerves which are supplying to the scalp. 5 nerves lies in front of the auricle, while the 5 nerves lies behind the auricles. Now in front of the auricle there are 5 nerves, out of which the 4 are sensory and 1 is motor. Now the 4 sensory nerves from before backwards, they are supratrochlear nerve, supraorbital nerve, zygomaticotemporal nerve and auriculotemporal nerve. So these are the 4 nerves, out of which the supratrochlear and the supraorbital nerves, they are branches from ophthalmic division of trigeminal nerve. The trigeminal nerve is 5th cranial nerve, which is having 3 division: ophthalmic, maxillary and mandibular. So these 2, they are the branches from ophthalmic division. Now the zygomaticotemporal nerve, it is a branch from maxillary division of the trigeminal nerve, while the auriculotemporal nerve, it is a branch from mandibular division of trigeminal nerve. So basically in front of the auricle, the scalp is getting sensory supply from trigeminal nerve through its 3 division, that is ophthalmic, maxillary and mandibular. Now behind the auricle there are 5 nerves which are supplying to the scalp. Again there is 4 sensory and 1 motor nerve. The motor nerve you already know, that is the posterior auricular branch of the facial nerve. Now in the sensory nerve, first one is the great auricular nerve, basically the posterior division of great auricular nerve. The great auricular nerve is a branch from ventral rami of cervical 2nd and 3rd nerves. The second one is lesser occipital nerve. It is again a branch from ventral rami of the cervical plexus, that is cervical 2 nerve. Behind that is the greater occipital nerve, which is a branch from dorsal rami of the cervical 2nd nerve. And the last one is the 3rd occipital nerve, which is a branch from dorsal division of 3rd cervical nerve. So behind the auricle, basically the sensory supply of the scalp is by the cervical plexus through their ventral rami and through their dorsal rami. So here you can see this is the greater occipital nerve. Now in a diagram you can draw that in your exams. This is the supratrochlear, supraorbital, the zygomaticotemporal, the auriculotemporal. So 4 sensory nerves in front of the auricle, and the 4 behind, that is great auricular, lesser occipital, greater occipital and the 3rd occipital nerve. Now coming to the arteries which are supplying to the scalp. Scalp is basically supplied by the 5 arteries, out of which 2 are the branches from internal carotid artery, while the 3 are the branches from external carotid artery. Now you can see, like the nerves, there is supratrochlear artery and supraorbital arteries. Similarly, the veins are there, that is supratrochlear vein and supraorbital vein. These 2 arteries, they are the branches from internal carotid artery. Now remaining branches, they are the branches from external carotid artery. The next one is superficial temporal artery. Superficial temporal artery is a branch of, that is external carotid artery, but it is the terminal branch of the external carotid artery. The next one is the posterior auricular artery, which is the branch from posterior aspect of the external carotid artery. Next is occipital artery, again a branch from posterior aspect of external carotid artery. So the 2 are the branches from internal carotid, while the remaining 3, they are the branches from external carotid. And here in this picture you can see very well that these arteries are making an anastomosis over the scalp. So if there is any minute injury, the bleeding will be profuse, as there is a lot of anastomosis over the surface of the scalp. Now coming to the venous drainage of the scalp, the supratrochlear vein and supraorbital vein, they will join and they will form the angular vein. At the medial angle of the eye, they will form the angular vein, which will then run on the face as the facial vein. Now the superficial temporal vein will join the maxillary vein and they will form the retromandibular vein, which will divide into anterior and posterior division. Now the posterior division of the retromandibular vein will join the posterior auricular vein and it will form the external jugular vein, while the anterior division of the retromandibular vein will join the facial vein and they will form the common facial vein, which will drain into the internal jugular vein. So this is about the venous drainage of the scalp. Now the lymphatic drainage, the anterior aspect of the scalp will drain into the parotid group of the lymph node, while the posterior aspect will drain into the retromandibular or the mastoid group of lymph node. Finally, these all lymphatic will drain into the deep group of cervical lymph node. So this is all about the anatomy of the scalp. Thank you.